Well, it's been called a key to reopening the economy. Today, New York State rolls out antibody testing in what Governor Cuomo calls the most aggressive such program in the country. CBS News' John Giaz joins us live from Midtown with more on this. John?
Yeah, good morning, Chris, to you. And pretty soon we're going to be seeing a whole lot more of these signs plastered throughout the entire state. This one here, the 42nd Street Health Clinic called MedRight. This health clinic is one of many that is now offering COVID-19 antibody testing. Cuomo saying that they're working with the federal government to ramp up testing in private labs all over.
When it comes to shortening the timeline for reopening the state, Governor Andrew Cuomo still stands firm that COVID-19 antibody testing could help. The state appears to be moving in the right direction. The COVID-19 rate of infection is stabilizing, and the rate of hospitalization is down.
We are past the high point, and all indications at this point are that we are on a descent. Whether or not the descent continues depends on what we do.
Starting today, the State Department of Health will begin conducting a statewide FDA-approved antibody testing survey, sampling 3,000 people for a population of 19.5 million people. Germany performed a 3,000-person sample with a population of 83 million. The large-scale testing will show how much of the population could now be immune to the virus, possibly allowing more people to safely go back to work.
And we'll take thousands of tests, antibody tests, over this next week, all across the state, to give us a real snapshot, a real baseline of exactly how many people were infected by coronavirus and have the antibodies.
Dr. Ayman Atiyah, a primary care physician in Whitestone, Queens, has already begun administering COVID-19 antibody tests. Speaking with CBS 2's Hazel Sanchez.
How critical is it to have these tests?
I think this is a very important test, but we don't want to give false hope to other people because this test has some limitations.
U.S. regulators say more than 70,000 companies have signed up to sell antibody tests, a blood test that can yield results in 24 hours. Because of its simplicity, the FDA waived the initial review of the test as part of its emergency response to the outbreak, leading critics to question its accuracy. People in the early stages of infection could test negative since they've yet to develop detectable antibodies, and Dr. Atiyah adds some who test positive for coronavirus antibodies are not necessarily immune to COVID-19.
You could be exposed to the other mild coronavirus, not the bad one that we have now, the COVID-19, and therefore we get false impression that you're immune, but you really are not immune against this bad virus. You are immune against the old virus.
Dr. Atiyah and many other medical experts say antibody tests should be paired with diagnostic tests like nasal swabs to determine whether someone is currently infected.
And something also to note is that the first bilingual walk-in COVID-19 testing site will open later on today in Washington Heights at Amsterdam Medical Practice. We are told, though, it is by appointment only, and healthcare workers there are expected to test more than 50 New Yorkers every single day. We're live this morning in Midtown Manhattan. John Diaz, CBS 2 News.
All right, John, thank you. You have to ramp those numbers up quickly, though, that's for sure.